quickly go through some more resources that we continue to find. And as I find these new resources, again, I'm posting them on this website at Arch Respite. You can see the link right there. Don't worry about writing it down because, as usual, I'll send these slides around to you after the call. And I'll try to upload them to the chat as well. But you will get them in your email. I did want to quickly mention some Medicaid resources that have been flowing into my inbox this week because some of them are very important to respite and to supporting family caregivers. In particular, I wanted to make sure you knew about actions that states are requesting through Appendix K options for home and community-based services using the 1915C Appendix K waiver authority. And states are using this to basically expand the number of qualified Medicare providers by having the flexibility to loosen qualifications. And that is also including permitting payment for services to family caregivers or other legally responsible individuals if the strategy isn't already included in your state's waivers. It's really great. Some states are using this to allow eligible recipients to hire their family caregivers as direct service workers when, quote, regular staffing for services approved in a support plan cannot be assured. And these services can include respite care, supported living services, and in-home supports. Pennsylvania used an Appendix K waiver to also allow service limitations to be exceeded on some long-term services, as well as respite care beyond the usually required or limited 29 consecutive days without prior approval. So it's kind of important to be following along, or at least look up what your state, if you don't already know, what your state's been doing to gain these flexibilities to better serve family caregivers and the people that they're caring for. Some other activities under Medicaid that are allowing increased flexibility, such as waiving prior authorizations for behavioral health and home health services. That's happening, but they're happening under other authorities like Section 1115 demonstrations or Section 1135 authorities. And states seem to be getting very rapid approval for these changes. So I found these resources on the website if you want to go into this issue a little bit more in depth, especially bullet number 1 on the CMS site lists approvals specifically for state Appendix K amendments. And I think some of those are the most relevant, especially payments for family caregivers and things that are related to the amount of respite that can be received. And again, you'll get these slides, so don't worry about writing down all the links. I added some new resources to government, national, and state headings on that website. I just learned today about a new fact sheet from Veterans Affairs, specifically for caregivers. So if you're serving any veterans and their caregivers, that fact sheet might be especially helpful to you. There's some really good resources on there. Advancing States just released a report on addressing social isolation for older adults. And this report is sharing with states and others, organizations and individuals, what kinds of activities and ideas that they're using to address social isolation, especially for older adults during this COVID crisis. I also wanted to alert you to an archived webinar that was put together by the Break Exchange that's run out of the University of Wisconsin School of Nursing. During that webinar, they featured our very own Val Madsen from the Respite Care Association of Wisconsin, who was talking about their online training, Finding Your New Normal during COVID-19. And many of you actually got to hear Val do that presentation on a week of webinars that they did a couple of weeks ago, and many of you participated in that already. But I wanted to let you know that it's also archived in this Break Exchange webinar, and you can listen at your leisure. It's a really wonderful online training that the Respite Care Association is making available to anybody who wants to use it. And then I just threw in some other very useful, again, new resources that I just wanted you to be aware of, and you can take a look at those at your leisure. I wanted to remind you again, I showed this slide last week, the Break Exchange, along with ARCH and the International Short Break Association, have put out a global survey asking people to share what the impact of the pandemic is on respite care services. I think this is a very exciting opportunity to talk about your own ideas and to learn what other countries are doing. It can be really enlightening and engaging to hear what's going on around the world. And you still have until April 15th to complete that survey, and it's fairly short. So we would love it if you would participate in that. And then, of course, through ARCH, we circulated this through our Lifespan Respite Exchange. We'd love to hear about any new voucher tools or written guidance or policy changes that you've put in place to deal with some of the challenges that you're facing with your voucher programs or other respite services. We talked a little bit on the first call, how are states collecting data on how the pandemic is affecting the respite services they're providing. And some of you talked about some of the data collection tools you're using. We'd love to get copies of those or links to whatever you're doing or short descriptions. And then again, any alternative respite strategies that you're using to support caregivers, either by calling them on the phone, doing special social media, any exciting innovations that you've come across since we started talking about this that you'd love to share with others. And you can either, if you're a Lifespan Respite grantee or partner, you can post those ideas right on the Respite discussion forum. If you're not, you can just email them to me and I'll make sure your great ideas get posted. So that's all I really wanted to share for today, and I'm going to open it up to all of you to ask questions of each other. Does anyone have any new things that have come up since last week that they'd like to talk about?
This is Rachel from Wisconsin. We are putting together Care for the Caregiver kits and mailing them to people who have reached out to us in the last year requiring about respite. A lot of it is self-care type things, comfy socks, chapsticks, large print, crossword puzzles, chocolate, and just trying to let people know that we're still thinking of them and potentially provide them with other outlets that might not necessarily be respite. However, a pair of comfy socks and chocolate and a word search puzzle might be exactly what a caregiver needs at this time when things settle down at nighttime and they can relax. So that's new from Wisconsin.
Well, I think that's a wonderful idea, just to let people know you're thinking about them is a big thing. So thank you for doing that.
Of course.
Anyone else?
Also from Wisconsin, this is Val. We put together end of last week a worksheet for caregivers to plan in case either they get sick or the person they're taking care of gets sick. It is linked on our Facebook page. That would probably be the easiest way to find it. Otherwise, it is embedded in that new normal resource training. But that's just a resource for caregivers to start thinking about it. So I just want to throw that out there as well.
Anyone else? This call is for you all. So if you have questions or things to share, this is the purpose of the call. So please go ahead.
This is Catherine from Colorado, and I think it was Illinois that started the quarantine and caregiving question and answer sessions on Facebook. And so Colorado, as of yesterday, is starting to try and do that. We're having a little bit of a slower traction with incoming questions. But I was wondering if anybody has any input on what platform you're seeing the best communication with families. So we're on Facebook, Instagram, and Twitter, and we do a newsletter. And I'm just wondering if anyone has any tips on which platform seems to be the most successful in reaching out.
Anyone want to talk about that?
I don't have, this is Rachel in South Carolina. I don't have an answer for that. We're looking into some of those resources too. And so I've consulted with our, the sort of the tech consultant that we have, the company that we use. And they recommend like WebEx, Cisco WebEx products over Zoom for that kind of thing. So I'm gonna look into that to see how that might work, and if there's costs for what we'd need.
This is Robin in Oklahoma, and I just wanted to mention that our caregiver coalition, the Oklahoma Caregiver Coalition, is continuing to meet, and we'll be meeting next Thursday by Zoom. And we've decided to highlight respite as our topic, and we have an extremely active respite subcommittee with the Oklahoma Caregiver Coalition, and I'm very actively involved in that. And so we all are going to send Nadine Walter a PowerPoint slide just highlighting the programs again that all serve caregivers, from VA and down to children with special needs, and just to make sure that everyone that calls in remembers to think about our caregivers, and we don't want to stop serving them. We want to do the best to reach them. So we were going to highlight respite as the topic of our next Caregiver Coalition meeting.
Great. Any questions for anybody? Also, if you had any questions about any of the resources that I showed earlier, I would be happy to respond to those to the best of my ability.
Jill, what was that? This is Rachel in South Carolina again. What was that survey that you were talking about? I missed all the details about that. Is that a needs assessment, a current needs assessment?
This survey that's being done, the global survey. This again is something put out by the Break Exchange, which is it was spearheaded by the University of Wisconsin with input from ARCH and the International Short Break Association. And when we were meeting with our international partners in the International Short Break Association, people were very interested in what was going on around the world to talk about respite or provide respite services in light of the pandemic. And so it's just a survey asking you what are you doing to support family caregivers and continue to provide respite if possible. That's the only survey I talked about.
Okay.
Does that help?
Yes, and we can share that with our networks.
Yes, absolutely. We want you to share it. The deadline is April 15th for responses. And then hopefully they'll be able to compile the responses, and we'll have a really beautiful database of new and innovative things going on around the world. Because of course it is a pandemic, so it's global. And it'll be a unique opportunity to not only hear from our colleagues in the States, but our colleagues around the world and how they're coping and supporting family caregivers.
This is Megan in Colorado. I know we talked quite a bit on the first call about vouchers, and I'm just curious if, I think now that the dust is settling a little bit, we're thinking more long-term about, what is realistic in terms of extending people's vouchers, but also knowing that, we probably do have some families that are on our wait list that might be able to use services while other families maybe can't, either due to geography or providers or things like that. And so I feel like we're kind of just trying to think through, is it really realistic to extend people a month or even 2 months at that point was just so much up in the air, but kind of trying to still, function as much as we can with our vouchers. So I was just curious if anybody else has made any changes in the last couple of weeks.
This is Tracy in Washington State. And we did do an extension to all vouchers in use out to July 1 and are constantly monitoring it and looking at the new applications that are coming in to also give those awards. So that was a joint decision in Washington State.
This is Corey in Nevada, and for my voucher program, we're sort of doing the same thing because normally I would try to get it done by the end of May, but right now we are extending it to the end of June. And then if necessary, I do have what the state calls an extended fourth quarter. I could go into that all the way to August, but I'm really trying not to do that.
This is Rachel from Wisconsin. I just have a question for those of you who have vouchers. How many people do those vouchers serve, or how many applicants do you get per year?
This is Corey. My voucher program varies depending on how much funds I've received. This year I have 397,000, so it'll add $1,000 a piece.
Okay, thank you for sharing that. I appreciate it.
Yeah, and so our fiscal year is July 1 to June 30.
This is Tracy in Washington State. Sorry for the back. And we gave awards out to 90 individuals in the first quarter, which was 9/1 to December 31st. We have 57 currently in use, and we just are in a perpetual batching of awards. As some people are just doing partial, some people have not completed, and we currently have 57 in use and are about to make some more awards.
This is Megan in Colorado. We have, I don't, Catherine or Amy, if you have the exact number, feel free to jump in, but about 90 families that have gotten awards through our fiscal year, but we pretty frequently get some that are partially used or some money back, so immediately turn those around. But we have a couple hundred about on our wait list right now.
This is Lisa in Wisconsin. For those of you that have a registry, we outreached to those on our registry to ask them if they still wanted to be listed on the registry during COVID so that we could keep it up to date. And we had a number of people that called or responded indicating they did not want to be available during COVID. That's one part of the question. The other part is anybody doing anything to get PPEs to the individuals that would be providing in-care or in-home cares for individuals? And I'm not sure what everybody has. We have some self-directed programs, so persons with disabilities can hire directly their care workers to come on in. And oftentimes they don't have access to PPEs right now, so just curious about the two things that are happening during COVID.
This is Veronica from New Jersey Family Resource Network. It's not an ideal process. We're statewide here in New Jersey, so we've identified some internal people in various counties throughout the state, and then we've been disseminating the PPE that we can get our hands on to those areas, and then we're working a drop-off pickup. Is the best way that we could do it. We're outreaching to our families and our staff, and then they're letting us know what their need is, and then I'm trying to just coordinate that locally. It's not best practice, but it is what it is for now.
You raised an interesting question. This is Jill, Lisa, or an interesting issue about providers who don't want to continue providing during this period. For those of you that are still offering vouchers, For families that want to use them, are they able to find the providers they need?
Jill, this is Cheryl Danell in Nevada. In our voucher program, we called to check on our caregivers and see if they were having an impact through this pandemic, to either suspend or lost their respite workers as a result. And several of them have a need to get a new respite worker. We're trying to help them with the recruitment efforts. That's going to be kind of a tough sell right now. But the ones that are being most successful, of course, those that hired their family members or friends. We're having about half and half. Half of our families have had an impact, half have not. And they're continuing to get some relief, some care through their respite arrangement, either a vendor who is still sending people out or a family friend member who they feel comfortable having come into their home. So we're going to be watching that to see, you know, what the results are. But those that are having an impact, we have been wondering how to kind of make up for what respite hours they are not able to access, or, and, you know, reasonably, understandably, don't want to have somebody coming to their home right now. So we're looking at alternatives, maybe extending the funding a month or so, you know, depending on how long this pandemic lasts and the restrictions are in place, or to increase the amount of funding that they may get to use during the remainder of their contract while we have funding still available. Of course, that all depends on when restrictions will be lifted.
We talked about a lot of these changes on the first call too, either increasing the dollar amount of vouchers or extending the time that the vouchers will be available. Has anybody else put any of those practices into place since we spoke the first time? Or are you waiting like Cheryl to see how long this pandemic will last?
Jill, this is Robin again. And since our first call, we have done that in Oklahoma. We have increased the voucher amount from $300 to $400 every 90 days. We also have done away with the household income limit. And then the third thing we did is that the respite provider could live in the home with the caregiver and care receiver as long as they're over 18 and have a Social Security card. That is from April 1 to June 30th.
Okay.
Okay.
Anyone else? Cheryl, you also mentioned that you were trying to do provider recruitment, and I wonder if you are doing that to any significant extent, who are you recruiting and what strategies are you using?
Maybe I'll have Autumn Blattman, who's on the phone, respond to that, because she's been handling a lot of that. But we went and did a sweep of various potentially sources for hiring part-time workers, CNA nursing programs, adult education programs, various temp agencies or employment agencies that would maybe serve this type of work, be appropriate for this type of work. And then we have them on a database that Autumn maintains, and as we have needs for respite workers, we actually develop a job description with the caregiver to say this is the position that they're hiring for, and then have a few avenues. We have to only use free resources, so it's kind of a network of resources. Autumn, did you want to mention anything?
Yeah, this is Autumn. we also do some outreach. I have some connections with other coalitions that are not just Respite. They're senior coalitions and coalitions that do a lot of outreach and maybe have really, really long listservs of people that they can distribute the job descriptions to. So I do that as well, which I think is really effective up here in Northern Nevada. In Southern Nevada, it's a little bit more difficult, but that has been really effective too.
For those of you that might be using volunteers, we had at one point talked about it, it's not permissible everywhere, but volunteers who are able to deliver items or do phone calling for you. How are you having trouble finding additional volunteers to provide services that might support family caregivers? Or do you have more volunteers than you can handle?
This is Corey in Nevada. And for our normal organization, Helping Hands, we have been delivering the food to the homebound seniors and such. And we have had so many people reach out to us to become volunteers. So it's been gratifying to see everybody that's reached out to us and want to volunteer. So we haven't had an issue with that. Obviously, once jobs are back in place and things like that, they're probably not going to be able to volunteer to the extent they are now, but we have a ton of people that have flooded into us.
Have you had to provide additional training or special training to these volunteers?
We give them, excuse me, they're not allowed to touch anything, the senior, any of that stuff. So, I mean, they call them when they're like outside, they put the bag down, they're wearing gloves, masks if they want. Excuse me. The senior opens the door, grabs the bag, and then it's done. And then the volunteer takes off their gloves and puts them in, a waste receptacle that they're carrying with them. And then they have a new pair of gloves for the next person. But we do background checks as well.
Mm-hmm. Great, thank you. Anyone else? For those of you that might have been supporting community or faith-based initiatives for Respite, are they asking for additional services and supports and guidance? Or just all of those services shut down now?
We offer faith-based respites in Oklahoma, and they have basically stopped until we have a clearance. We have a declaration of a state of emergency, of course, in Oklahoma, and so we are adhering to that. We tie those in with sibling support programs, sib shops, and other sibling programs as well. So, but our faith-based programming we are having to stop until we get the clearance that we can start that again.
Yeah, that makes sense. Anyone else have any other questions?
This
is
is
Lisa. Go ahead.
Oh, I'm sorry. This is Cheryl Donnell in Nevada. If we had any information from ACL about how they would like to have current respite grantees handle maybe extensions or requests for how to do a grant makeup for the suspended respite services we may be encountering. Do they have any recommendations on what they would want grantees to do? Do we know?
Lori, do you want to take that? I can't answer for ACL, but she may still be on the phone.
I am still on the phone. Hi, this is Laura Stahlbaum with ACL. We have about a week or so ago, we received some new guidance because of the pandemic from the Office of Management and Budget with regards to no-cost extensions or carryovers, which are generally not a problem anyway. But oftentimes, basically that a lot of grants are ending this August, but a lot of work has had to stop, not from lack of effort, but from lack of, availability and able to leave our homes. So we have been given additional authority when reviewing and extending grants after the end of the project period with the no-cost extensions due to the pandemic. So if there's work that you're not able to complete, which I'm well aware of, and you submit a request for a no-cost extension, which can be for up to 1 year, that's always the rule. No-cost extensions can't exceed 12 months per request. You can, if you indicate, which I'm sure you would, that it's due to the coronavirus pandemic or COVID-19 or however you want to refer to it, then we have the authority to be a little more open-minded in the structuring of the no-cost extension, I guess I would say. On our acl.gov website, when you go to the home page, on the top left, there's a COVID-19 box section, special box right at the top. I think it's black with red writing. Oh, I should go look. And I look at it so much, but I forget. Oh, no, it's white with blue. Coronavirus 2019 information. It says information for older adults and individuals with disabilities, but in reality, if you go about halfway down the page, the web page, there's a section for grant and program guidance, and there are FAQs regarding discretionary grants. And just this morning or last night, I was thinking I should send out a group email to let people know we've been a little chaotic ourselves. So sometimes ideas come up and actions are not immediately following. But no cost extensions are always an option, though we have a bit broader authority because of the pandemic. And if my grants management specialist, Sherlonda Blue, was on the phone, she could help me explain the difference between the two, because I'm the program officer and Sherlonda handles the business fiscal side, and it generally the authorities have to do with the financial information you have to provide is a little bit different due to the pandemic.
Lori, could you also tell us how early a state can request a no-cost extension? For example, if they know right now, just based on what's happening, that they will definitely need one, can they request it immediately, or do they have to wait to until a certain time before the end of their project?
Thank you, Jill. You can request a no-cost extension anytime. Actually, the other side of the coin is it must be requested no later than 30 days before the end of the grant period. So with the August 31st end date, you'd want to submit your request no later than July 31st, August 1st, just to give us time to process it, because we got a lot of different things coming through. And I'm trying to find, but if you know what you're going to need what you're going to have left at the end of your grant program, and that you're going to need to continue forward for, I always recommend when you ask for no cost extension, unless you can do otherwise, you know, especially in this right now. You can ask for a year, but you can get done sooner. If you ask for 3 months, you know, then you have to ask for another 3 months if you're not done in time. And I'm sorry, I'm on the FAQs. Extensions. Okay. Oh my goodness, 14 references. So you can ask anytime after now, but at the same time, you may be using costs that you were planning to use for vouchers for other things or for prep things, or like we're talking on the phone, some of the people that you're doing calls or baskets, which are not the same as the cost of a respite voucher, but you're still incurring a cost and kind of don't know where that's going. It is okay to wait until closer to July.
How about a request to repurpose funds that states might have set aside for services, vouchers or other types of respite services? Does that require an official request, or can they just work that out with you?
Yes and no. I'll just start straightforward then. If you can repurpose funds if the act, I mean, it talks about providing respite, but we're in a different situation. So if you want to repurpose funds for something that's allowable under the act and within the scope of your project, and you know, that can be, if you feel we need to discuss it because it's kind of loosely connected, or you're not sure if there's a straightforward connection, I'm happy to talk with anybody about that. But if it is the amount of money you want to repurpose is 25% or less of your total award funding, you do not need permission from ACL to repurpose funds. If it is over 25% of your total award funding, then we would have to request a revised budget and a formal approval, which is why it's a yes/no answer.
Right. That's very helpful. Thank you, Lori.
Sure, I appreciate the questions.
Did that answer your question, Cheryl?
Yeah, I mean, I think that's important information that we are grappling with right now. Another thing that Nevada, we are already looking at state budget cuts across agencies and budget reviews, as projections in Nevada are looking pretty bleak for tax revenues. And so, you know, writing for new grants where we have state match requirements or changes in staffing levels. Right now we have a hiring freeze already, but we could be looking at furloughs. We've done those things before, reducing hours that we worked each month, and basically budget reallocations to priority services. Our governor has already designated respite as a not essential service in Nevada. So that kind of, you know, I'd love to hear what other states are learning about cuts or future funding plans for respite, or any ideas that they've already generated or know that they're going to be dealing with.
This is Lori. Jill.
Go ahead. Mm-hmm.
Well, I'm not sure that this is helpful, but thinking out loud or thinking while I talk, if you're, in terms of applying for a new grant, one thing about match is the match has to be met. It's, how do I say this? It's, you committed in your application, but you have the full 3 years to spend it. Federal funds can pay for staff that aren't already paid for by other federal funds. And what was the other thing I was going to say? Match does not have to be money. Match could be someone allowing you to use their facility without charging rent for a training, for example. So if, you normally use the community center and they charge you, $100, and they said you don't have to pay the $100, that's an in-kind match of $100 that your grant can declare against the grant. That's just from the federal head side. I'm not on the ground.
Thank you, Lori. Did anyone else want to respond to Cheryl about potential future state cuts that might impact your services? You all should know, if you don't know already, that in the last major stimulus package passed by Congress, there are some new funds in there for respite, not for lifespan respite program, unfortunately, but the Family Caregiver Support Program will receive $100 million in infusion of funds immediately or very soon. So if those of you work in collaboration with your with your Family Caregiver Support Program, you might want to be aware of that. The issue that I raised about Medicaid being a little bit more flexible and allowing, for your Medicaid eligible populations, allowing respite flexibility for service providers and more days of respite, that could be helpful. And there will be a fourth stimulus package from Congress that may include additional funding as well, funding that also will help support nonprofits generally. There've been some funding to date. So you might want to just, I published some information about that in the last Arch Quick News update. If you need more details about what was in the last congressional stimulus package that's infusing some money into states, let me know and I'd be happy to share more information with you.
Hi, Jill, this is Lori again.
Mm-hmm.
Hi, everyone, this is Lori again. Talking about the infusion, actually, ACL just posted a Gov delivery, which is our public messaging service, about the ADRC, Aging and Disability Resource Center program, received $50 million in relief funds specifically for the COVID-19 pandemic response. And there is a posting on grants.gov to prevent, prepare for, and respond to the emergency, talking about the disproportionate effect on older adults and people with disabilities, and support ADRCs in their work to connect populations to resources, ensure coordination, etc. And I know a lot of the coalitions, a lot of ADRCs, a lot of the states work through or with ADRCs. So I just, while we're on the phone, want to bring that to people's attention. I don't know any more about it than what I'm reading in the Gov delivery. I knew the money was there, and I knew they were working to get the announcement out. There will be a phone call, an informational conference call tomorrow at 2 p.m. Eastern Time. So you might want to share that with your coalition members or with your teammates, depending on which agency or organization you're with.
Yes, thank you for mentioning that. A lot of our lifespan respite grantees also manage their state's ADRC program. So
right, I just don't know, if an ADRC person's on the call, or I know they're parts of the coalition, but so
oh no, absolutely no. But I'm so glad you raised it because
truly hot off the press just came into my email, and I'm on the public distribution list, so I'm not getting it any faster than it's not like ACL staff gets it after the public. I get it twice. The second one is to ACL staff, and it comes much later. So
I didn't see that yet today, but I may have missed a lot of emails.
Yeah, maybe I don't get as many emails you, but and I do think that with these, thinking about the Office of Management and Budget thing, just to give people a heads up, and I could very well be wrong, but my understanding is that these emergency critical relief funds do not necessarily have to have a 60-day turnaround. They could be less. So Award ceiling is 3 million. Award floor is 300,000. Oh my gosh. Closing date for applications is April 15th. I thought it was 30 days. So anyway, if you might want to go look at it. I know that's not answering Cheryl's question, but it just popped up and it felt important.
No, it's definitely in relation.
It's in our
to
bailiwick.
Respite grants because they're mandated partners. So.
Right. Well, and it may be a talk coming back to redirecting funds. I mean, the ADRC may get more funds, but that may allow the other members of the coalition to repurpose funds to help build on some of those outreach and other activities.
Yeah, exactly. Yep.
Which would be totally allowable and perfectly fine. And if it's less than 25% of your total funds, you can just do it. I mean, you're welcome to talk to me, but I'd love talking to people. I've been home a month now. I'd love to video talk with someone. But anyway, so just some, maybe that's an opportunity to advance some repurposing. I'll mute now.
I'm so glad you mentioned that. Anyone else have any questions for each other or for Lori or for me? We're coming up to the close on our hour, and if there's some new topic that you would like Arch to research and present on next week, or if you'd like to have a topic discussed in more depth, we can ask for an outside speaker to present on the call. If you're still interested in continuing this call next week, are most of you interested in that? I should probably do a polling question if I could figure out how to do that. Just let me know afterwards. Send me an email that says you'd love to, or put it in the chat box that you'd love to see more of these calls, and whether you'd like to continue in the current format, or if you would like us to think about bringing in outside topics with other speakers. I'm getting lots of yeses in the chat box, so we will schedule another call next week, even if it's just to continue chatting as we are now. But if you want to continue in this current format, please think about questions during the week that you'd like to ask, or jot down some resources that you'd really like to share with your colleagues. That way we'll have a very fruitful and productive and interactive discussion. I'm going to open it up one more time for any last comments or questions from anybody out there. Okay. Oh, go ahead.
I just said a big thank you.
Oh, a big thank you to all of you too. You're doing fantastic work out there, and
thank you
for being so committed to this issue and wanting to keep in connection with each other. I think the calls are very helpful and give us this opportunity to do that. So keep up the great work, everybody, and please, please, please stay safe, stay healthy, and I will send out all the information about next week's call within the next day or two, as well as a recording to this call. Well, thank you, everyone, and have
Jill.
a really great
afternoon.
afternoon.
Thank you, Jill. Appreciate that.
Thank you, Lori, too, for all your helpful information.
Stay safe, everyone.
Yeah,
You
yes,
too.
stay safe. Bye-bye.
Bye-bye.